Hello, this is Dr. Acebedo. Today we're going to be talking about autoimmune disease and cancer and how that relates to each other and how we're going to treat patients if they have coexisting condition like cancer at the same time autoimmune disease. So let me begin by talking about what is autoimmune disease. Autoimmune disease is when you have an imbalance in your immune system, and mainly we have what we call the Th1 and Th2. What happens is the Th1 is your part of your immune system that directly kills any foreign invading like bacteria, viruses, or your or any foreign bodies that is not recognized by your body, basically. Th2, on the other hand, is the one that gets stimulated by Th1 by producing antibodies. And what happens in autoimmune disease when we take in foreign substances, like for example heavy metals, mercury or aluminum, they embed in your tissues and then they create a chronic inflammation where your body attacks it. And when they attack it, they get an immune response, and now they create an antibody against your own tissues where these chemicals that shouldn't be there is embedded and causes an immune reaction. Thus, now your body will mount an immune response to that tissue. For example, thyroid, where you develop thyroiditis or autoimmune thyroiditis or Hashimoto's disease. Another way of that happening is when there is a leaky gut, for example, inflammation in your gut, and then anything that you eat, for example, any chemicals out there, again, heavy metals, it enters into your circulation. Now your body will recognize it as foreign, and some of these molecules are closely related to your tissues, or they express antigens that are closely related to your own tissues. So when your body mounts an immune response, they will also recognize some of these molecules that are attached to your other tissues, and now they attack the tissues. So basically, now you develop an autoimmune disease. What are the common autoimmune disease? For example, SLE or lupus, and we have rheumatoid arthritis, Hashimoto's thyroiditis, and those are the most common ones. And we have other connective tissue diseases. Now, what's the relationship between autoimmune disease and cancer? Most of these, as we know, cancer is caused by chronic inflammation, and autoimmune disease is chronic inflammation. And for example, if you have rheumatoid arthritis, there's increased risk of you developing lung cancer, and just because of the chronic inflammation. And then there's a disease called Sjogren's syndrome, which is where you have symptoms of dry eyes, dry mouth, and that when you have this type of autoimmune condition, you have an increased risk of developing lymphoma. And typically it's the salivary gland, because that's where that's the gland that's affected with Sjogren's syndrome. So some of these autoimmune disease can also, like for example, another example is systemic lupus erythematosus, or SLE. Most common cancer that arises from it is lymphoma or cervical cancer. We have several patients in our experience in our clinic where they have both cancer and also autoimmune condition. We have cases where we have thymoma, and which is a tumor of the thymus gland, which is a gland behind the breastbone, and also developing myasthenia gravis, where it's manifests as neurologic symptoms. They have weakness, and they have eventually have muscle weakness, basically, because they develop antibodies on the acetylcholine receptor antibodies. The problem with this, if you have a coexisting condition, is the treatment. So we have immunotherapies out there that might be too challenging. It's a medical conundrum for the medical community when you have autoimmune disease and existing cancer, because as of now, conventional doctors, oncologists are really careful in administering immunotherapy to those patients who or candidates, but at the same time we have existing autoimmune disease, because now the theory there is there will be a possibility of a flare-up of the autoimmune condition. For example, if you have rheumatoid arthritis and let's say you have lung cancer, and one of the treatments might be an immunotherapy, and as far as we know, we have in the market we have the Yervoy, which was the first immunotherapy that was approved by FDA, and then we have Keytruda. Most of the studies that were done in immunotherapy, they exclude those patients with autoimmune disease. However, in 2019, they're starting to, because we have these immunotherapies for quite some time now, we know the possible side effects. Now they're including, now they're enrolling, I think there's a clinical study on it now that involves autoimmune patients with autoimmune condition and getting immunotherapies. I know there are integrative doctors, oncologists who uses immunotherapy in some of their patients, but explain to the patient knowing that they might have flare-up of their autoimmune condition. In this case, we usually give suppressing their autoimmune condition, which is probably dexamethasone and prednisone, is what we typically use if they have a flare-up. So in that case, we're really very careful in doing this. And another thing that I would like to consider is when a patient has cancer, usually, for example, I have a patient right now with thymoma, and she developed myasthenia gravis. The key here is treating the cancer itself. Some patients, they develop what we call paraneoplastic syndrome, where they have a cancer and then they develop a neurologic condition where they develop antibodies against, the certain parts of the autoimmune system, nervous system, either the myelin sheath or the nerve. Then they develop a neurologic condition, the difficulty walking, talking, and the reflex, their swallowing reflex will be affected. For example, in a patient that I have who has thymoma, the goal here is to treat the root cause. So there's no clear treatment for paraneoplastic syndrome. Most of the time when you treat the underlying cancer, their symptoms, like she developed myasthenia gravis from it, their condition usually will improve. The key is treating the main cancer. Now, there are also cases where right now we have 2 rheumatoid arthritis patients and they have cancer. You have to be careful about treating them with immunotherapy, especially we use a lot of mistletoe in our clinic, and very rarely though we get some side effects from mistletoe where they develop flare-ups. I would say less than 5%, but still there are things like that happens where the rheumatoid arthritis will develop flare-up in their condition. So in this case, we stop the mistletoe treatments because mistletoe, as we know, it has immune stimulating effect, immunomodulation. So for those patients with underlying autoimmune condition, there's a potential to have the flare-up. But again, we only see this in less than 5% of our patients with autoimmune condition and cancer. In these cases though, what I usually do is I will stop the mistletoe and give them some prednisone or dexamethasone to quench the inflammation and the flare-up. So it's case-to-case basis, and it's not an absolute contraindication. If you have cancer, if you want to do immunotherapy, there will always be that. You have to weigh the risk and benefit ratio here, and it all depends on the clinician and clinician's experience as to how to deal with it. So if you are a cancer patient and you have an existing autoimmune disease, I would say, if you're a good candidate for immunotherapy, I will go for it, knowing you can have some flare-ups. We can always minimize the flare-up. And another patient of mine has cervical cancer and has rheumatoid arthritis. And at some point she was on mistletoe therapies. Then she never had a flare-up, but I put her on hydroxychloroquine as just to prevent, first of all, and number 2, hydroxychloroquine as an anti-cancer. It blocks autophagy. What autophagy means is as you start to kill cancer cells, some of these particles are released in the circulation, and some of the remaining live cancer cells, have they'll grab these particles, and in a process called micropinocytosis, or we call it autophagy, hydroxychloroquine blocks it to prevent them from getting these nutrients from the dead, cancer cell fragments. So, as a summary, autoimmune disease and cancer, we can treat it, even if you have autoimmune disease and cancer that coexist. But again, it's a case-to-case basis, and it has to be in accordance with you and your doctor talking about it, knowing the risk, and discuss it, with your doctor. It's not an absolute contraindication, but there are ways that we can use if you're a good candidate for mistletoe therapy, for example. If you if your doctor thinks that you will benefit from it, and there's less chance of you having a flare-up, yes, I will go for it. If you're a candidate for immunotherapy, the conventional immunotherapy, and your doctor says, yeah, you'll benefit from this kind of treatment, we can always deal with a flare-up. And again, in our experience here, is rarely we get some flare-ups, and we can always treat that. So again, thanks for listening. Again, this is Dr. Acebedo. Talk to you soon. Bye.